In the first 4 months of 2023, more than 400 bills targeting the rights of transgender people have been introduced across this country. And according to the ACLU, which is tracking these bills, over a third of them specifically target access to gender-affirming care. Now, the rhetoric surrounding transgender individuals in general and specifically trans health care carries a few themes.
We should reject this demonic assault on the innocence of our children.
These treatments and procedures have a lifetime of negative consequences that are irreversible. It is dangerous, it is destructive, and I will say it, it is evil.
Evil and demonic. All right, let's talk about what it is. Healthcare for trans youth, what's known as gender-affirming care, is being hotly debated. It's been severely limited, if not completely banned, in at least 15 states. There's so much vague language in these bills and in the discourse surrounding them about what it means to be trans and what it means to receive gender-affirming care. An NBC News poll from this month revealed that only 28% of Americans know a transgender person closely. The vast majority, nearly three-quarters, say they do not. And in that same poll, they found that 48% of Americans think that society has gone too far in accepting transgender people compared to 43% who believe we need to be more accepting. But if there's so many people who are not personally familiar with a trans person, it's understandable that the issue of gender-affirming care might feel confusing or foreign. So we thought it would be best to try to demystify gender-affirming care. Because so much of the rhetoric targets trans and non-binary youth, I'm going to start with what gender-affirming care means for kids. Now, this information comes from the American Medical Association, the American Psychiatric Association, and the American Academy of Pediatrics, and from the Trevor Project, which is an organization dedicated to advocacy, health, and safety for queer youth. Gender dysphoria is when a person senses a difference or incongruence between their biological sex as assigned at birth and their gender identity, or the gender that they mentally and emotionally identify with. If a child experiences gender dysphoria, the first step is psychological and emotional support, as well as what's called a social transition. That means that in a supportive environment, a child experiencing dysphoria would be able to talk to a therapist. They would have the safe space and encouragement to try cutting their hair or growing it out. They'd maybe try wearing different clothes or try out a new name. It's a gentle way for kids experiencing dysphoria to try living as the gender with which they identify. LGBTQ clinics are known to provide all of these things, counseling for kids and for parents, even referrals to queer-friendly hair salons. Now, when a child approaches puberty, gender-affirming care might include puberty blockers, which are intended to buy young people time before some sort of secondary sex characteristics begin to develop, such as facial hair, voice changes, and sex organ development. That kind of hormone therapy is only available to minors who meet the criteria as established by the American Academy of Pediatrics and the Association for the American Medical Colleges. Some of that criteria includes a finding that the youth has experienced several symptoms of gender dysphoria listed in the DSM for at least 6 consecutive months, a letter of support from the youth's licensed therapist, and a written concurrence from a mental health professional for the provider. Parental consent for those under 18, remember, that's part of the recommendation, and ongoing psychotherapy. Other types of physical therapies for transgender people are typically only available to older teens and adults, usually people who have stopped growing. And those include hormone replacement therapy, electrolysis for unwanted facial hair, and finally, gender-affirming surgeries. And those same criteria that I mentioned before, like counseling, persistent and consistent gender dysphoria, and for youth, parental consent if they're under 18, all of those criteria apply there too. It's important to point out that gender-affirming care, which includes all the things I mentioned, is considered necessary, life-saving medical care by every major medical and mental health organization in the United States, which represents nearly 2 million doctors in this country. They all stand by gender-affirming care as medically necessary. Trans and non-binary youth face levels of depression and suicide that are much higher than any other group. More than half of trans youth have seriously considered ending their lives, and according to a study by the American Medical Association, that number decreases by 73% when those kids receive gender-affirming care. A 73% decrease in suicidal ideation is an astounding outcome. No drug or antidepressant even comes close to having that kind of impact. So this really is life-saving care, plain and simple.